Welcome back. This week we are talking about environmental hazards and disasters. So let's start by identifying what an environmental hazard is exactly. So the definition is that an environmental hazard affects human health, disease, and injury. So examples of this could be living patterns, work risks, air quality, water quality, housing, food quality, waste management, and or violence risk. So what do you think of when you think of an environmental hazard? Could it be possibly about where we live? For example, if we live on the coast, people are going to be more exposed to earthquakes, hurricanes, and therefore they have to build their homes differently. How about social norms? If you think of Wisconsin, what's probably the first thing that comes to your mind as a risk? Alcoholism, right? Wisconsin has more bars than I have ever seen in any state. You can go down a small community and there can be 4 bars on each corner of an intersection. So alcoholism and consumption is a huge environmental hazard based on social norms in our area. How about cultural norms, such as the South? They're known for fried foods that we know are very, very unhealthy. So when you think about environmental hazards, you have to think very broadly because it can affect or be affected by many, many different factors. So Healthy People 2020 have objectives related to environmental health, and they revolve around these 6 things: air quality, groundwater, toxic substances, homes, communities, infrastructures, and global environmental health. So Healthy People 2020 have identified these objectives. And how does nursing play a role in these objectives? Well, nurses need to be knowledgeable. We have to have a basic knowledge of what environmental hazards are out there for the populations that we are trying to serve. And how do we get this basic knowledge? Well, it can come from reading. It can come from being cognizant of current news events. So, we have to stay current in order to have this basic knowledge because we need to provide knowledge to the community on these hazards. And then, of course, community health nurses are trying to put programming in place to prevent and control the environmental factors on the community. Assessment is recognizing these key environmental problems, and advocacy is acting within our role as a population advocate. So you can think of this in the legislature aspect. If we understand policies and major pieces of legislation, we need to support change for the good of the health of the population. So nurses are a very, very large entity in the healthcare field. And we can be really instrumental in making change regarding these environmental hazards to the community. And we have to be active in legislation to get these hazards diminished and so it doesn't affect the communities. Now, big business, if you think about them, they lobby in their best interest. And their interests are to make money. They're not so much concerned about how their toxic wastes are going to affect the health of the community. They're looking at the bottom line and what's the most economic way to, say, expose of these toxins. So nurses have to advocate for the public and help institute change and put policies in place that help control these hazards from the community. So I'm going to have you watch this quick little video here. It was made by the Canadian Nursing Association and discusses environmental responsibilities of nurses in regards to environmental hazards.
I guess my biggest environmental worry is probably pollution and maybe global warming.
Pesticides is pretty big.
Superbugs, the flu pandemics. There is a problem with climate change right now.
I think it's all the things together.
People ask me what environmental health is, and I always have to go back to the definition that was put forward by the World Health Organization.
Environmental health deals with issues such as clean water, clean air,
and the impact of smoke, greenhouse emissions, toxins and carcinogens, and the health and well-being of people.
We're part of the ecosystem, really. You know, what we do has an effect on the environment and vice versa.
It's such an important health issue, and you know, the water is already lapping at our doorstep, if you like, and we really have to do something now.
It's one of the key issues facing nurses in healthcare in Canada today.
Concerns about the environment and the cleanliness of the environment go back to Florence Nightingale in the 1800s, where what she saw was that if we are going to be effective at dealing with diseases, we have to be thinking about all the vectors that can cause disease, and we have to be thinking about making sure that we're minimizing exposure to disease from the environment.
There's been an enormous leap from the beginning of, I guess, this century through this past decade in what we know about environmental health and how the environment affects individuals' health.
What's newer for us is thinking about sort of the larger macro kinds of environmental issues, whether that be climate change, which is so much in the media right now, or environmental hazards and environmental toxins and so on is a factor in illness and disease. And I think that means that we have to be looking at different ways of working, I think, as nurses.
My biggest environmental worry is probably fresh water.
Global warming is one of the biggest concerns.
I would say pollution. Pollution, I think, yeah.
In the recent months, the Canadian Nurses Association did some focus groups with Canadians across the country. I guess my biggest environmental worry is probably pollution.
It's what you eat, it's what you breathe, you do it every day.
They talk to us about air pollution and respiratory problems. They talk to us about toxic chemical exposure and problems with chronic disease and aggravating chronic disease and cardiac issues related to environmental risks. The public also told us that they believe that nurses need to play an even bigger role in dealing with and helping the public deal with what we now call environmental health issues.
I'd say pesticides and pollution that gets into our food is a big problem.
Nurses in surveys rank very high amongst the public's trust, and so that means they are listened to when they speak.
I think nurses have a really important perspective to bring to these issues. It's partly because of where we work and what we see through that work, and perhaps sort of a surveillance function that nurses have in seeing some of the early indications of change that's happening, the implications of environmental changes on the population.
What motivates me to do this is an absolute conviction that it has to be, that things have to change.
Why do I want a greener world? Probably because I have children that will be having children.
The chance to do something that I really feel like I'm making an impact.
I want us humans to be able to live on the planet as long as possible.
And for me, that's what I look for in my work. For me, my work is about making a difference. And I honestly feel that I'm making a difference.
So, in a nutshell, that's really what our role is as nurses, is to advocate for the public. And how do we do that? We do that with our levels of prevention, again, when we are working as community health nurses and trying to put those policies and programs in place that are going to protect the community. Supporting environmental standards. And supporting those policies being placed on environmental standards for companies and pollution. Monitoring the situation through our epidemiologic data collection that we talked about last week. And finally, the citizen role. Not only are we nurses, but we are also citizens. So we can voice our opinions as nurses and as citizens, and we can educate the public about what these environmental hazards are and encourage them to be advocates in the legislative process also. So we're going to talk a little bit about categories of disease. You can see the different categories that are listed here, and we will go through each of these individually. So chemical. Chemical hazards obviously are going to be those pollutants or those toxins that we get exposed to. And these can be accidental also. So if you look at the slide, you can see that one of the accidental environmental dangers was the 2014 West Virginia chemical release, where 10,000 gallons of industrial chemical was spilled into this river, and it affected over 300,000 residents in the surrounding community and polluted their water and had trouble with their cooking and drinking and bathing needs. One you're probably really familiar with is the 2010 Gulf of Mexico oil spill that was related to the gas company, the BP. And that went on for a very, very long time and was very costly for cleanup, and affected not only humans, but it affected the animals living in that environment also, which in turn, you know, we are all connected. So if the environment is changed, it changes life for humans also. So chemicals can also be used intentionally as weapons. So, you know, it could be some toxin or communicable vector could be placed in our water system or in our ventilation systems and affect very many people. So what's important for nurses to realize is when we are involved with the chemical exposures, as healthcare providers, we are going to be also direct care providers. And we need to make sure that before we get involved, that the hazmat team has been in there and the industrial hygiene and engineers have deemed the area safe for us to go and provide care. And we're always going to want to be using personal protective equipment to protect ourselves from that contaminate as we're trying to help the community members. Another type of hazard is biological or communicable. And again, we've gone over the epidemiologic triangle, and some of the diseases that we have been exposed to as of recently was the Ebola and the measles that we talked about before. Now, an epidemic is when a widespread occurrence of the infectious disease becomes apparent. A pandemic is actually an epidemic that has spread to a larger region. So some examples of that was smallpox, tuberculosis, HIV, the 2003 SARS outbreak, or the 2009 H1N1. Those were pandemic kind of situations. Now, when we talk about Ebola, Ebola actually was an epidemic. It affected multiple countries in West Africa. And we did have a few cases in the U.S., but it really did not become widespread. So it was not a pandemic situation. But if we think about all the media that was around Ebola, it was very important that we got those messages out so we could teach people how to protect themselves against the Ebola. And then, of course, state and country put in some safeguards to try and protect the public. So, for instance, anybody coming from West Africa who came into the United States airports would be screened for signs and symptoms of the Ebola to try and contain it. But if we look at all the media about Ebola and compare that to, say, influenza, now Ebola had a death toll of approximately 10,000 people, but influenza has a death toll of 26 to 32,000 people every single year. But we don't hear as much about that. So we have to be cognizant of the message that we're giving out to the public, because really we can create a panic among the population. So we have to make sure that when we're educating the population that we're really clear about the risk it has locally. And so that we don't use the media to unintentionally cause a panic situation. So another example is radioactive nuclear. Okay, this can come in many forms. The 2013 earthquake that hit Japan, that I can hardly say this, tsunami. You don't say the T, right? Tsunami that occurred and damaged that nuclear power plant, let off huge amounts of radioactive iodine, and it caused evacuation of 70,000 people within a 12-mile radius of that nuclear plant. And it had longer term effects than just the radioactive potential to contaminate the people, but it contaminated their food sources and their water sources, and had just a huge impact on that population for a very long time. But if we think about radioactive agents in, say, not such an extreme case, you can think of the sun. The sun lets off radioactive rays all the time, and it has been a leading cause of skin cancer in our population. So a simple thing like the sun, or radon. You've heard of radon, that odorless, colorless gas that that occurs under homes. And what happens there is that as decay occurs of the uranium, like in the rocks and the soil, it gives off this radon gas. So, I mean, we deal with this all the time. But how can we use, say, radon as an example of how a nurse can be involved? So if you think of primary prevention, basically what we're trying to do is educate the public about the risk of radon in their homes. Our secondary prevention is to have residents screen and test their homes to see if there is radon present. And then our tertiary level is to fix those homes so that we try and maintain the problem by sealing the cracks and gaps in their floors and around their piping, or putting a ventilation system in their home. So each of these hazards, we as nurses can do something about it. So let's talk about natural disasters. These are some examples of natural disasters. In our area, we can think of tornadoes. We can think of blizzards. All of these natural disasters have the potential to cause huge, long-lasting effects on how communities function and the health and well-being of the individual members in the community. Some man-made disasters: 9/11, Boston Marathon, the mass shootings. Those are all man-made disasters, again, causing vast destruction of communities and affecting all individuals within that community. So Healthy People 2020, another objective they have is preparedness for these massive natural or chemical, radioactive, these disasters that have the potential to affect mass amounts of people and the environment that they live in. So what is our plan for disaster management? Basically, there are 4 stages to disaster management: preparation for, planning, relief, recovery, and mitigation. Prevention is Potential risks are identified and tried to correct for. So again, if we think about hurricanes, a prevention strategy that we use in our planning for those populations is perhaps building their homes up on tall stilts to try and decrease damage if that should occur. Preparedness and planning is actually training people, gathering resources, figuring out what our communication structure is going to be if a disaster occurs, and how we would respond to a disaster. Relief efforts are once a disaster has actually happened, what are our relief interventions going to be? So that could be sheltering in place. How are we going to evacuate the people? How are we going to do our search and rescues? How are we going to triage? Where are we going to provide care to people? Okay. And finally, the recovery or mitigation stage is where we're trying to rebuild that community. So when a disaster happens, there is a chain of events that occurs. So in our disaster preparedness, it starts with our local community. Our local community has to have planned for a disaster, built up those resources in order to deal with the disaster. Now, all the best planning doesn't mean that we're always going to be successful. So at the local level, if the disaster exceeds what we in the local community have planned for, and it exceeds what we can handle, it then gets elevated to the state level, where the mayor evaluates the situation and determines if the state needs to become involved. So if the state deems it a medical or a natural disaster emergency, this is at the point of the state level that we would be able to call in like the National Guard to get extra help and resources to deal with the disaster and the mass destruction that has occurred. Now, if it exceeds the state level, then there would be a plea put to the President of the United States to have a federal assistance for the disaster. Okay, so this could include like what they call national stockpiles. So they call them push packs. And at this level, if FEMA gets involved, there would be massive stocks of antibiotics, massive stocks of medical supplies, personal protective equipment, antidotes, antitoxins that would get pushed out to the local level to deal with the mass destruction that has occurred. So let's use an example and look at how this system worked or didn't work. So let's talk about Katrina. I'm sure that you all remember that situation in New Orleans, right? So the local community had planned for the potential that there could be a hurricane that would put the community at risk. So what happened with Katrina is that the mayor of the city actually announced the evacuation too late. So what occurred was, in their planning process, they had planned for 15,000 residents to be stranded if a disaster occurred. So all of the resources that they had planned for were based on that number. But since the mayor announced evacuation too late, what they ended up with is a larger, much larger amount of people who were stranded in the city, and they didn't have enough resources to handle that amount of people. So what resulted was a call to the state, and the state came and put in the National Guard to try and assist. And what happened then is even the state couldn't, this disaster was much, much larger than they had expected. and they couldn't handle it. So they put a plea to the federal government for relief. And what happened with the federal government is that they should have been available in 3 days, but it took them 4 days. So it was just a continuous breakdown in timing and getting help in the Katrina situation that ended up it being a huger mess than it should have been. So what does the local community do when we're trying to plan for disasters? Oftentimes they'll do things called tabletop exercises, in which they'll have all the community members that would play a role in a disaster, like the police, like healthcare facilities, the hospital, large businesses in the community, school systems in the community, and of course public health. All of these entities would get together and they would have a fake scenario that they would work through as a group. And what the role is for the tabletop exercises is to clarify each entity's role, clarify evacuation plans, develop teams of response, assess resources. Where are their holes? Where do they need to beef up on resources? And identify possible improvements. And then another thing that occurs are drills. So it's the same scenario where they would have a fake situation, a fake disaster, and we would actually act out the response to this disaster to try again to identify any role issues, any education needs, any holes in our resources. Those are some tactics that we have used at the local level for planning. So disaster planning, again, it has to go all the way down to the individual level. So we are trying to educate, nurses are trying to educate the public on how they can be prepared for a disaster. And that would include things that are on the slide. Do you have emergency numbers? Do you have an evacuation route? Do you have enough supplies in your home to care for you and your family should you be stranded for 3 or 4 days? And then we encourage them to practice these drills at home. So some things that we try and tell people to make sure that they have enough supplies at home are listed here. And I've also put a video on Blackboard that was made by the American Red Cross, and it's called Shelter in Place, which will go over much of this. I encourage you, as even a student nurse, to share this resource with friends and family and try and get people close to you prepared for a disaster. That is one way you can get involved and you can start this process. So a couple things about a disaster supply kit that I wanted to point out to you, because it was actually quite shocking to myself, because I never really realized how much you need. So for instance, water. You're supposed to have 1 gallon of water per person per day for at least 3 days. Can you imagine how many jugs of water that we need to put aside, have stored in our basement for a disaster? Food is another one. At least a 3-day supply of non-perishable food. We should have dust masks to filter out contaminants, plastic sheeting and duct tape to seal off our windows, moist towelettes, garbage bags, so that we can defecate, because if there's no water, electric, our toilets aren't going to work. You have to think about all these things that you normally wouldn't think about. And so this video is really, really good, and I encourage you to watch it and share. This is just a list of community resources about emergency management. So you can peruse these. They all have a multiple resources and education pieces that you would benefit from. So what is the nurse's responsibility in a disaster situation? So we've talked about educating and informing the public. We're also going to be responsible for seeing security and safety for people who are injured. We're going to be responsible for triaging the injured and determining who gets care. Now, one thing I want you to keep in mind is disaster crisis management triage is going to look much different than what we are used to as nurses. So think of yourself in the hospital situation. How do we as nurses prioritize on which patients are going to get care from us first? Well, we prioritize based on severity of case, right? Who's the sickest? That's how we prioritize. Who has an emergent need? We will see those people first. Now, if we're talking about nursing in a disaster or a crisis situation, it's the opposite. The people that are the worst injured, the worst off, we are not going to waste our resources on those people and try and save somebody who may not be able to be saved. Excuse me. So we are going to use what they call a triage algorithm, and it's called START. And what it stands for is Simple Triage and Rapid Treatment. And basically it's a color coding system, and we're going to actually run through in class an exercise so that you can see how this works. But basically, if a person is so badly off, we as the triage nurse would have to mark their forehead with a black, indicating deceased, unsavable. And that's going to be really hard because those people may actually still be alive, but they're so severely injured that we're not going to be able to save them. So we would have to mark them with a black, and so on and so forth. The other end of the spectrum, if somebody is walking around and they're wounded, they're walking around, they're not that bad off. So we would color them green, and we would not expend any time on them because they are not that bad off. So again, we will run through an exercise in class regarding this. Another thing is we're going to be direct care providers. We're going to be providing emergency care and first aid. And then the last role is crisis intervention. So if you remember back to our very first learning plan where we talked about stress and crisis, and then again in our anxiety where we talked about stress and how it can cause anxiety up to the level of panic or crisis. This is going to occur with people who are experiencing natural disasters, any disaster where there's a crisis. At first, people are going to plan. They're going to go into that life-saving mode, right? Then when their resources start to dwindle, their stress level is going to get higher and higher, and the fear is going to set in until finally people get to a panic level, in which this is where you see things like looting in the stores, hurting other people to get their supplies. That's that panic. They're not thinking logically. They're very irrational, and they're in survival mode. This is where nurses are going to have to be involved in crisis intervention, trying to help these people feel like they are safe. You're there to help them. You're going to get through it. And doing that counseling and intervention to try and lower those anxiety levels so we are not functioning at a panic level. So that ends our lecture on environmental hazards and disasters. And we'll be doing some really fun activities during class time just to try and work through some of these topics. So we'll see you in class.